got some new things available as far like on the estate planning and legal services. So that's all really exciting. But I am not the expert, Tish. You are. So again, thank you for making time today. Everyone that's on the call, thank you for tuning in and making some time today. And with that, I'm just going to turn it right over to Tish to get started and share some updates with us.
Thanks, Steve. Hi, everyone. Hope you're well. If you haven't ever met me before, my name's Tish Sitzow. I'm at all the markets, so make sure you come visit me. I'm always in the IFRA offices. I live and breathe IFRA when I'm in the furniture markets because I just love you guys so much. You're my people. So I have been working really hard, guys, on trying to find things that are great for you as association members, things that would enhance you being, a 1099 employee. I don't even like to call you employee, man. You guys are gig people, man. You guys are out there, doing your gig and getting stuff done. And so based on that, and based on lots of you coming to me going, Tish, can we do this? Or do you have this? I have been doing a lot of things. So I'm announcing something right now today that I have not even told Steve. I've told no one, but I'm telling you guys are the first ones to know. I am merging with a larger agency so we can now be a full service agency. And that means my team that is coming with me, all of us at Woodforest Insurance Partners, we are merging. And when I say a full service agency, we're going to be able to do your home, your auto. We can help you with commercial. We can help you with liability. We're going to be able to do the full gamut. We're looking to make that change July 1. You might see some emails, some things that'll change a little bit when it comes to like my email address and stuff. But guys, you'll always be able to get a hold of me no matter what. I am a member of IFRA as well, a proud card carrying member. And so we are doing some huge things to add, but this is brand new for anyone outside of my organization because we've been working behind the scenes for about 6 months to be able to add these additional services. So FYI, my new agency will be Dean and Draper. I will still probably have America's Healthcare Experts as part of our overall platform. But for you guys today, FYI, if you see me change an email address, it's because I'm adding more stuff. So let's get started. In your membership portfolio with IFRA, you must log in to your membership portfolio to get into this page. This is now your benefits page for everything that comes from me. Okay. So this is our work number. So you can get a hold of me. I did have my cell number on here, but I was like, oh my gosh, you guys are going to kill me. So this will be answered by the agency. And then Kelly, of course, is always with me. She's probably on this call too. So, we're always here to help you, but this is going to be what your landing page looks like when you go in through ifra.org. Only members of IFRA get to see this page. I am clicking down. Okay. So all I've done is come down, and part of this call is navigation. Okay. So I'm going to get into the technical details of navigation so you understand everything. But even though I've made this all at your fingertips, okay, I'm not going anywhere. I'm still available. This is really just to kind of get you a little bit of information ahead of time, and then we can move forward. So as we grow and add some of those other things like home and auto, and I'm also getting a guaranteed life insurance product that I'm working on. I'm hoping to have that in July. So that means you'll be able to have guaranteed life insurance even if you have cancer. Oh, yeah. Guess what? If you actively have cancer, I'm going to be able to get you guaranteed life insurance. Now, if you're terminal, that's a different conversation, right? But for just basic health, it's going to be guaranteed. That thing is coming very quickly. So as we add these things and as we add home and auto, each one of these boxes are going to have another box. Okay. So these are the three basics that we're adding day one. And then over the next 2, 3, 4 months, you're going to see us add more of these little blocks. Okay. So I'm going to not start with all of the health insurance and benefits. I'm going to let my partner, Noelle McEntee, run this because she's with Legato. Legato is an estate planning service. They came to me asking how they can help support our association. And I was so excited to learn more about them that they came and they're offering their base plan free to every single one of your members. I said free. I said no cost. If you're a member of IFRA, you get the base product. That is this plan right here. I'm going to let her talk first, let her kind of explain it a little bit more. You do access this directly from your website, from your member login. But most importantly, it's a benefit to you that is at no cost. So let's start there. Noelle, I'm going to let you kind of drive a little bit. I'm going to shut my tail and I'm going to click more info, guys. So see that right there, more info, and it takes you straight here. So Noelle, you're up, babe.
Awesome. Thank you so much, Tish. It's really great to meet you all today. I know the first thing you weren't excited or thinking about that you were going to chat about today was necessarily estate planning. But as you can tell, we are not your typical estate planning company. If you can think about it, where I have two co-founders. One has been in the operations and employee benefits space for a long time, and another is actually an estate planning attorney. I think of them as the architect and engineer, and I get to come in and actually make it look beautiful and something we want to do. Hopefully just as good as you all do in your roles and positions. So we're going to jump in a little bit and I'm going to explain how this all works. So I just want to make sure that I can drive. Do I have that ability now? I think so. Can you all see my screen? Hopefully, yes. Great. So when you log in to the, oh, you can't see it yet? No. Okay, let's try that again. We're
I
gonna
can
look.
see it on my side. I don't know if anyone else.
Oh, Tish, you might need to click over to a different screen. It might say Noelle McEntee's screen. We're good? Okay, great, cool. So when you log in through the portal, you'll come to this hellolegato.com /IHFRA. I believe you say it as IFRA, so forgive me if I butchered that. And you'll be able to log in right here. All of your email addresses have been loaded into the census, so you're not having to do a lot of creating an account. So you'll come to this page, you'll put your email address in, just like this, and then you'll get a magic link sent over to your email. Once you're logged in, the platform will look like this. So a few things I want to clarify before we really jump in. The term estate planning is an umbrella term, right? Think about it as an overarching umbrella that talks about many different documents that you need to live and die better, essentially. So you have everything from healthcare directives to durable powers of attorney to wills and trusts. A lot of people think, oh, well, I don't have enough for that. That's not true. You have enough. I promise you do. And it's especially important if you have a home, if you're a small business owner, if you have minors, if you have pets. All of us deserve to have a legacy and estate plan, which is why my business partners and I created this. We wanted to make sure more people had access to tools like this, because if you have a birth certificate, you deserve a comprehensive legacy and estate plan. So the two packages that we offer, the one you all get is our our essentials package. And that includes a ton of different documents. It includes advanced medical directive recommendations. So based on your input, what are the things that you might be needing to look for? Some of them we provide, some of them you might need to go to your local hospital for or your doctor. And because of the way we've done this, we also ask both you and your partner these questions. So it's not just a one person journey. This is collective for you and your partner, which you don't have to legally be married to create an estate plan together. One thing a lot of people also forget is like we create a will or a trust and then we forget to actually communicate our wishes. And I don't know about you all, but I've been to a heck of a lot of funerals or memorials which did not represent the people, and that can cause a lot of family strife. And I definitely don't want to be buried in or cremated in a really ugly suit. So I made it very clear in mine that there's going to be rosé and there's going to be a lot of good music and fun, and there better be a lot of color. So point being, you go through this process and you're able to communicate those end of life preferences and store it with your estate plan. So there's never any question. I know that might feel a little morbid to think about, but what I will tell you right now is that creating a legacy and estate plan is the greatest last gift you can give your family. And so Yeah, so you might have to wrestle with that a little bit, but it doesn't bring you any closer to the end. It just makes things easier for your loved ones. So, you know, breathe through that, think through that. But I will say that 9 times out of 10, everyone's always said, I'm so glad I did that. And if they didn't, then they are probably wishing that they had added more to it or something. You also get a basic will. So this is what you need to ensure that you don't die intestate. That means without one. The majority of places will still have you go through probate. Probate is the process of settling an estate, and on average, it takes 16 months. It can be very easy. It can work well. If you want to avoid that, I'll tell you a little bit more about that later. But at minimum, you need a basic will. We have our HIPAA release if you want to make sure that your pet is taken care of. We also highlight the type of legacy you might be creating. Your legacy is more than your bank account. And the more you think about and work backwards of what you want it to be, the better able you are to really create that and create a legacy that feels good for you. So all of these documents are created by us for you. And that's included in your IFRA membership. If you'd like to upgrade, you can also get a revocable living trust. There is a discount for you all for that. It's only $360, which is a total steal. And the reason being is that we started this company. I lost my uncle, and I wanted to make sure that no one was unable to get a plan the way, I wish he had had. So just so you know, my estate planning attorney co-founder has worked and done thousands and thousands of these. And when people hear that this is what we're doing it for, I say, we're not here to make a buck. We're here to protect people's families. So
I will step in 1 second and say, I just had a trust quoted to me by an attorney, and it was $4,200. Okay. That's a lot of money. So, and I don't have a lot of money, y'all. So, I mean, $4,200 is a lot of money. So 360, oh my gosh, that's huge.
Yeah, it's the I could go into a whole monologue about how information around trusts and how much it actually costs to make them has been gate kept. And even the AARP got buried a study in the 1990s, so people didn't know that they needed them because attorneys make so much money during probate. But I won't get into that today. We'll do some investigative journalism together another day. So how do you do this, right? You log in, you're like, great, cool, I want to do this, but like, how do I get started? So when you first log in, you're going to see a page like this. It's going to prompt you to start your journey. This is 7 sections of all the information we need to create your comprehensive legacy and estate plan. The best part is that if you do want to do that upgrade to the trust, you don't have to answer any additional questions. There is a little bit of work in terms of actually putting the trust into setting it up on the back end in terms of getting it notarized and all that. But what I will tell you is anyone I've spoken to said it is so worth doing that. It's a little bit of extra work now to ensure that it's not a heck of a lot of work for my family members later. And trusts actually allow you to circumvent probate. So that's a really good point. So you go through all these things. We have Morticia Addams. We have Gomez Addams as her partner. It then creates the documents for all of them. We also have our legacy library, which highlights a lot of different tools for folks. For example, we were talking about death literacy and really maybe you want to make sure that your loved ones have a plan because you want to make sure that you're not going through this with your, parents or whomever. There's a lot of tools here to help you start those conversations, as well as a lot of other things in terms of if you're a caregiver, did you know that there's caregiver counseling? So I say all that, there's a ton here, but the point being is we're trying to really make things easier for everyone to be able to live, die, and just enjoy life. And last but not least, we also have 3 add-ons. If you want to chat with someone on our team to just talk through a few things to make sure you're going into this the right way, happy to do so. If you do get upgrade to a trust, an attorney will email with you back and forth. But if you want a live review just like this, you can upgrade there. And if you'd like a custom funding guide for if you get a trust, that's as well. But first things first, what I would say is go through the journey. If you need to, block some time off on your calendar, sit down with your partner, or whomever, and go through those steps because I promise you, you can get it done in less than an episode of The Gilded Age, as I know that's coming up soon. And get things printed out because you'll be glad you did. So I'll stop there. Happy to answer any questions.
Um, uh, I'm going to ask you real quick. So how you're going to send an email out today, right?
Yes, so everyone will be getting an email around 12:30 today associated with sent to their email that's associated with the association. If you want to jump in earlier, you're more than welcome to. Just go to this link and click get started and use that email to get logged in.
And we did go ahead and
Perfect.
put that link into the chat for anyone that's on this call. No immediate question for me, but I'm personally, I hate to say it, I'm not excited about the thought of this, but I have, I guess, a little bit more of a peace of mind. I know I personally at 40 hadn't taken the time to make a basic will yet, and it's something
Yeah.
that you don't ever think about or want to think about, but it really is so essential.
When you have kids, you want to make sure you know where those kids are going to be taken care of. Some time
Yeah,
you
exactly.
and your spouse or your partner. So yeah, awesome. So can you guys
Well,
see
what
my?
and
Oh, go ahead.
one last thing on that note, because this is something that I didn't know until getting into this space. A lot of people have life insurance, which is great. That's exactly what you should do, especially if you have minors. What a lot of people don't realize is that if you add a child or a minor as a contingent beneficiary, so maybe not your spouse, but the second beneficiary, um, they wouldn't have access to those funds until they're 18. So here you are trying to do the right thing, setting them up as a beneficiary, but it actually isn't going to work the way you want. So if that's something you want to avoid, that's also something we can help you with the trust. But either way, the will is a great place to start. Get that done, get it set up. And then at any point you want to get the trust, again, it's just an upgrade, not a lot of extra work. And we're here to help.
Awesome. Thank you, Noel, so much for joining today. I appreciate you
Of
making
course.
time. Thank you so much for on behalf of IFRA for giving us this program for free. We really appreciate you.
We're so excited to support you all. I'm a big fan of designers, interior designers. Was going to do that in another life, and hope to be able to meet some of you in the future. Please don't hesitate to reach out. We're here to help.
Thanks, Noel.
Thank you so
Okay,
much,
guys, are you
everyone.
back to my screen where it says documents and services at the top?
Uh,
Noel, unshare. Okay.
yes, I think so.
Okay. So just in summary, just to finish up hers, this is actually kind of like what is included and what's, included in essential and standard. So if you'll notice, these are all the things you're going to get for free. And then the other ones you'll have to pay a little slight upgrade. So that is directly on your Legato page. It kind of shows you these pieces. So I'm going to move on from this process. But again, that was this piece right here directly from your portal. So again, you will get an email to activate and get started whenever you want to. No one sees that. So I do want to tell you that it is still your personal information is protected. None of us will ever see any of that. It is only related to you. So I just want to get that out there. So now let's get into medical. I have a lot of you already on these plans. We have been working really hard to find plans that are good for gig people. We did launch a couple of different products last year, and we kept, trying to hone it in and get it better. And one of the things that continued to come to me and was being asked all the time is, I need different networks. Blue Cross Blue Shield is, everyone likes Blue Cross Blue Shield name, right? I need different networks. So we went out, started looking for carriers that would allow us, because keep in mind, guys, you guys are not like a traditional group. Not everybody comes to work every day and clocks a button and punches a clock. So we had to find something that works specifically for people like you, 1099 people like me, people that are out making their money. They need to not worry about what the government's going to tax them on. Okay. I'm going to cover that in 1 second. But things that are flexible for you guys to use on the road, because most of you travel. B, things that are, affordable, and C, flexibility. So what we did is we worked with a carrier who it's on Gerber Life paper. Okay, Gerber as in the baby Gerber, so it's been there. But we are in the in the group space, you can do something called rent networks. And that's how some of these carriers are able to get an Anthem, which is Blue Cross Blue Shield in some places, Anthem in other places. It's all the same. And we are able to use the Anthem National Network. We can use the Cigna National Network, or we can use something called PHCS. Now, in the past, if you had PHCS with either America's Choice or any of the guaranteed issue products, that was a different PHCS. The networks on these new plans, guys, is PHCS, the big one. And when I say the big one, I mean Johns Hopkins. I mean MD Anderson. That means Cleveland Clinic. All those places you really want to go if you really get sick, these plans cover it. There is going to be a caveat, and I'm going to tell you that right now, okay? I don't want anyone to question me. It's even on your page. See this right here? This, because we have to be considered working members of any particular group to have group coverage, because this is group coverage, we will all be working members of the plan. And what does that mean to you? It means that you're going to answer a survey once in a while and talk about what your plan looks like, okay? That survey, they're going to pay you to do it, all right? But this is our way to prove that you are a working human being. You can answer one, you can answer, they say it's going to come out monthly. I have yet to see that happen. I know you answer the one survey when you log in for your first time to get your card. So have 5 minutes to do that. What are the surveys like? Do you have pet insurance? Would you like pet insurance? What this is allowing us to do is expand our portfolio, control the plans, so that way we know we're not paying for things we don't need, but we're staying exclusive to our group. Okay, so that's important for you guys to know. That is the one caveat, but that keeps us keeping those prices under control. It allows us to continue to enhance your plan. Okay, so now what do we do? Going back to navigation, guys. Check eligibility from a medical perspective on these plans. I'm not going to talk about these over here because this is a little different. But on these plans, guys, there are a few medical questions. They are very high level, but they're going to be, pretty strong. So it's going to be basic, have you had cancer in the last 5 years? Do you have cancer now? HIV, AIDS, or knockouts, muscular dystrophy, muscular multiple sclerosis, those big things, guys, are knockouts. If we are in a knockout and you cannot answer no, or you have to be able to answer no to all these questions, again, you'll be able to see them on your page. But you'll need to be able to answer no to these questions because that's how we're able to get you on there. If you cannot answer no, that's a phone call to me because we will find something else. Now, these plans are not going to be based on your income. Income is marketplace, also known as healthcare.gov, also known as Obamacare, also known as ACA. All those things are the same. Those are income-based plans. Those plans we enroll, November 1 to December 15th for January 1 coverage. All right. Those are guaranteed issue plans. There are no pre-existing condition questions, waiting periods. Those are subsidized by the government if you are in an income-based plan. The thing about income-based plans is that if you make more money than you expected, guess what? You pay back all of your premium. We don't want to do that. So if you are on an income-based plan, there's another thing that you need to know. In 2026, a lot of people who are getting subsidies now will lose those. There were some new subsidies or reduction in costs that were provided through COVID. Those are expiring at the end of 2025, meaning if you're getting a subsidy now, you might get it reduced or taken altogether for 2026. It's going to be very important for you to follow up on this. I can't give you your answer today, nor can you find your answer. But beginning about mid-October, you're going to get that letter. And then you'll find out exactly where, what it is that you need and where you're at. Okay. So keep that in mind as you get ready. If you are on Marketplace, healthcare.gov, Obamacare, Cover Me New Jersey, Penny, all of those places, those subsidies are going to change for 2026. So keep that in mind because this is going to be something you're going to start talking about as we get further into the year. These plans, you can come on to these plans anytime, okay? So no matter if you have a special enrollment period or what's called a qualified life event, you lose coverage, any of those reasons or no reason at all, you can come onto the plan. You can drop the plan at any time, but if you needed to come back onto the plan, then you're going to have to wait till open enrollment. We do go through open enrollment with every one of these plans calendar year. Okay, so we're going to follow the marketplace and ACA. The plans are guaranteed renewable. So once you are on the plan, guess what? They can't kick you off until you turn 65 or you go on to Medicare. Okay, so these plans are good for you until you get to Medicare. Now, there are these deductible. We have a $1,000, $2,000, and $3,500 deductible. We have a $4,900 and $7,250 deductible. All of these plans are the same, and I'm going to click on them in a minute, but I just want you to know all of these plans are the same. You pick your deductible right here. You pick your deductible and you pick your network. We can pick Anthem, Cigna, or PHCS. Again, Anthem is Blue Cross Blue Shield for those of you in the western part of the country. Anthem, it's the same network, but it's the national PPO. So if we are actually going into check if we're actually going into, I just clicked on more information. We can actually go into the Anthem provider lookup right here, and it'll allow us to go, and you'll see it's going directly to the Blue Cross Anthem website. See, goes right here, and you can find care. All right, and we can go look up what we need to look up. You can basic search as guest. But if you have a Blue Cross Blue Shield product now, this means that this will actually move over. Now, it is not insured by Blue Cross, okay? That's the one thing that I get a lot of questions going, Anthem can't find me. It's not Anthem. It's Gerber using Anthem's network. That is how all the private carriers are able to go out and still be competitive. You get to use their network with their contract prices, all right? So that's one thing I want you to understand, that that's kind of how that works. But as far as the plans themselves are concerned, all of the plans are the same. If you hit on those actual lines, it's going to show you the deductibles available and your network options, if you can see that. I'm going to make it a little bit bigger, guys. So, but every single plan's the same. I can just only get so many on a PDF, all right? So a $1,000 deductible, a $2,500 deductible, and a $3,500 deductible. As you can see, these are considered unlimited. Therefore, they are ACA and group compliant, all right? So you're not going to get into any kind of situations or stickiness. There you have in and out of network benefits, okay? So God forbid you have to go out of network or you choose to go out of network. It's really hard to go out of network with Anthem, okay? You will have coverage. Now, for those of you that are... sorry, if someone can mute yourself, that'd be great. The one thing, if some of you are old enough to remember, do you remember when we had 80-20 plans? So you'd have a deductible and 80-20 was your co-insurance. Well, guess what? Those don't exist anymore except for you. Now you guys have an 80-20 plan. So how do deductibles work? Remember, so a deductible means that things that are associated with the hospital, you're going to have a money out of pocket first. So hospital-based stuff, and again, we can get into the line item details, but think about it this way. In a deductible situation, things that go to your deductible, you pay 100% of the contracted rate. And again, Blue Cross Anthem has the best contracts up to your deductible. Then between deductible and out-of-pocket max, which is out-of-pocket max means that's the most you will ever spend other than your premium, you're going to pay 20%. They're going to pay 80% of the contracted price. And then once you hit your out-of-pocket max, and it's the same on every single plan, $9,200 for an individual or $18,400 for a family. Once you hit those numbers, everything the rest of the year is at no charge to you. So 100% of contracted price before deductible is yours. Then you have that what's called co-insurance in between. They pay 80, you pay 20, and then after out-of-pocket max, they pay 100%. 100% you share, 100% them. So that kind of just like, that's how it breaks down. But every single plan has the same out-of-pocket max. So it just depends on when you want to come out of pocket first on the big stuff. Telemedicine is free on this plan. You get 100 per telemedicine. That has been the biggest positive note that I have had from anyone on these plans, that it's called My Live Doc. You'll get an email about that when you enroll, but it's been one of the best telemedicines. I had one lady that said she called and she had antibiotics at the doctor an hour later and she never had to go into a doctor. And she's like, it was the best thing I've ever done. So the telemedicine is free. It covers all, all your supplies, etc. But if you'll notice here, now we're going to get into the line items. Everything across the board is the same. It's a $25 copay to see your primary. It's a $40 copay to see specialists, a $60 urgent care, and a $30 chiropractic copay. Telemedicine, like I said, is free. Emergency services are deductible and co-insurance, but there is no additional access fee. If you have like a Blue Cross Blue Shield marketplace plan, not only are you going to pay your co-insurance, which is that percentage, you're also going to pay anywhere from a $400 to $1,000 access fee just for going into the ER. So you don't have that here. Your labs are a $25 copay. That is not going towards deductible and co-insurance like your marketplace plan will. X-rays are a $100 copay. Again, you're not having to pay your deductible. You're only going to deal with that deductible when you need an MRI, a CT scan, you need to have surgery, you go to the emergency room, or you go in the hospital. Everything else is copay based. It makes it easy. You know that when you walk into the doctor, you give them your card, you pay your $25 and you're done. Of course, all your preventative care is at no charge on all of these plans. All therapy, not only chiropractic, but physical therapy, speech therapy, cardiac rehab therapy, all of those have a $40 copay. And then this does include home health care, hospice. God forbid we have to get in a situation. It does cover organ transplants if necessary. So these are full major medical plans. As long as we can answer no to those questions, you have no pre-existing condition waiting periods or exclusions day one. Now, we must enroll by the 20th of any month for next to the month coverage. So if you're watching this live today, we are already past our enrollment. Well, we could have enrolled today, but it's not possible. We're already past our July 1 effective, but if anyone wants to come on August 1st or later, we're available. We can do that July, as long as we enroll by July 20th, you can have August 1st. Now, as you can see here are the drug copays. In many cases, I will say that this is, we need your mail order, your regular maintenance stuff will be mail order, okay? So keep that in mind. Your maintenance stuff, you'll get it the first 30 days, you can do retail, but after that, if it's maintenance, it's gonna be mail order, or you're gonna go pay cash if you prefer to do it at your pharmacy. However, if you'll notice, the one thing that it does not cover are specialty drugs. What is a specialty drug? If it has a commercial, guys, it's not covered. Let's start with GLP-1s. There are a lot of people on weight loss drugs or using them for diabetes. If it's an Ozempic or a Mounjaro or any of those fancy names, or you've seen a commercial, guys, they're not going to be covered under these plans. Now, if you get on these plans and then you are diagnosed and need one of those, guess what? They actually have a pharmacy benefit manager that we've built in. So we'll get involved with you and help you source those and get patient assistant programs with the manufacturers available to you. So there is assistance to help you get those, but they are not covered by these plans, again, so we can keep these plans affordable. So on every one of these PDFs, and again, I'll go back and show you on page 6, which is the last page, it has all of the pricing and it's by tiers. So you're one of 4 tiers. Let's go with the cheap kids, but let me show you how to work it. So this is the $1,000 deductible. Here is the network for PHCS, your cost, for Cigna, and for Anthem. If you'll notice, you just pay another, $60 to upgrade to Cigna, and then another $20 from Cigna to upgrade to Anthem. I'm telling everybody, just go with Anthem if you can afford it, because you won't ever, it's an Anthem. It's Blue Cross Blue Shield Anthem. But the plans are the same. You pick your network, you pick your deductible. Nothing else is different, okay? So you don't have to compare, okay, what's the copay here, what's the copay there? That's not an issue, okay? It's you pick your deductible. We have $1,000, $2,500, $3,500, $4,900, and $7,250. So if we just jump over and look, this is going to be the least expensive major medical plans that we have. Again, these are not income-based, so they stay the same price no matter how much money you make, guys, okay? They stay the same price. So this is going to be the higher deductibles, $4,900, $7,250. Again, the PDFs, all of them work the exact same. So again, in-network, out-of-network. And you can see that this is our least expensive plan, is the $7,250. So if you're young, we can start at $510. And then if you're like my age, then we go all the way down here to $579, okay? For PHCS. And again, that's PHCS called the front of card, meaning their largest network that they have. It's not any of the limited networks. It's not a limited benefit plan. Therefore, you do not have a limited benefit network. Those are those plans, guys. The other plans we have are something called visit limit plans, which are value plans. And in those plans, and I'm so sorry, guys, because my link isn't working for them. On the visit limit plans, here's what they are. We have a deductible from $250 to $1,500, so a $250 deductible. But it has limitations to it. It's going to be much more economical. What are those limitations? You get 10 doctor's visits. You get you get a certain amount of days in the hospital. You get a certain number of surgeries per year. You can still pick the Blue Cross Anthem network. These are going to be the most affordable plans. And again, my little clicker link isn't working right there for some reason, so I got to go check that. But it'll also be a PDF that looks just like it. All the VL plans are the exact same. Again, pick a deductible, pick your network. Cigna is not available on the value plans. Okay, they are not there. However, every Blue Cross Blue Shield is. I'm telling everybody, pick the 250, the lowest deductible, because on the VL plans, you must first hit your deductible before anything's covered other than preventative. So 250 deductible, then it's a $50 copay. All right. Those visit limit plans are fantastic. They're affordable. I think we start at like $339. So those plans are going to be very good. They're great for your 26-year-old kids coming off. They're fantastic for family building. They have a $250 copay for pregnancy and a $250 copay for labor and delivery, or $500 copay for C-section. So yeah, you can have a baby cheap on these plans if you're still in that mode. Again, all those plans will be the same. You pick your network, you pick your deductible. More info on these plans, guys. This is actually if you wanted to get, complete details, like if you wanted to understand everything. The pricing, if you don't want to read the PDFs, you can do that. States, let's talk about these. These states are all available. Here's where the states we cannot bind coverage. We can't bind coverage in those anything on the West Coast except for California. Guess what? We can write coverage in California. We cannot do Washington, Oregon, Minnesota, New Hampshire. Think of those that you hear a lot of times having issues with the insurance industries. Those are going to be the ones we can't write. It does not mean you cannot use these plans, okay? You can use some plans in all 50 states. It means we cannot bind coverage, all right, in those states. But you can use them anywhere. And then you can download a full brochure specifically for the plan that you like if you choose to go this deep into it. But it is there if you want to get into it and what those plans are. So that's the medical plans. Okay. I hope I kind of went over that. Again, if you have questions, call me, reach out, email me. I'm happy. But now let's talk about this NCBA. This is a great program for a couple of reasons. I'm summarizing it here for you so you can see. But I want you to see the price here of $79.95 is the top of the line plan. It covers everyone in your household, whether you have one person or 50. If they live at your address, you can include them. That means mom and grandma, you're taking care of them. You can include them on your plan. It's one price. It's not per person. But what this has is it has 24/7 free telemedicine. Okay. So I'm telling everybody that this is an affordable option if you just can't afford health insurance yet. Okay. You're just starting or you're just in that mode. This is not considered insurance. So if you have Medicaid or if you have something lower, you don't, this is nothing to do with your income, but it's something that can help support you, or it's a good stepping stone. So with it, again, free telemedicine, it has 200 of your, 200. Is that on here? Access to medications at no cost right here. Your generic medications, your maintenance that I was talking about on the other plan that's mail order, guess what? On here, those are all free. Maintenance drugs, free. So if they're generic, like you take lisinopril or you take atorvastatin or any of those high blood pressure or cholesterol, your thyroid meds, any of those that are maintenance drugs, they're free on this plan. And that means your whole family, remember? Also, free your labs. How many times, guys, have you gone and had your labs done and it was like, oh my God, it's $175 copay, or it's my co-insurance, blah, blah, blah. $7 is the draw fee. But anything else on there, the tests are free. You need to get your cholesterol checked, free. You pay for the $7 drug draw fee. Again, this is for your whole family. The other thing, Right here, vision and hearing benefits, guys. Vision and hearing. Okay, so it uses Aetna. Now, this is a discount plan. These are not insurance products. Please know that. Okay, they're not insurance. However, it's great for, again, a stepping point. Now, on the it also has a bunch of other benefits, and you can click on the link, and I'll show that to you in a minute. But I wanted you to see the big things that it is. If you need, I actually joined this my own self because the MRIs and CT scans, it comes with something called Recuro Health. Recuro Health is a low-cost way of managing costs for imaging, labs, and colonoscopies. It's called Radiology Assist, Laboratory Assist, and Colonoscopy Assist, where you can go and use these, and you're paying what an insurance company would pay on a contracted rate. So, for instance, an MRI, I actually had someone. I signed them up on this to help them. They went from having an MRI that their part was 2670, like 2,670, and we got it for $250 using this program. So this is a good way of protecting your pocketbook. Now, on the plus plan and on the premium plan, the plus plan comes with $5,000 of accident insurance. Something happens, it pays all your expenses up to $5,000 per person per event. The premier one is $10,000. Okay. Life insurance, it does come with accidental death and dismemberment insurance. It's $50,000 for the plus plan, and it is $100,000 for the premium plan. That's for the primary. Okay. So these plans are very affordable. They're great to have either as in lieu of if you just can't do anything else, because who can afford to cover their family for $80, right? So this program, whenever you click on it, this is going to give you kind of a little high-level overview of the medical expenses that we have here, the 24-hour nurse line, hearing aid discounts, mental health hotline. So this is a lot of stuff that you can get. And here's kind of where that Recuro Health comes. You actually do get a card. I have a card that I plop at, at the imaging place, at the lab place. And the lab place I know works because I just did it. And I went and I paid my $7 draw fee, and that was it. And I had all my labs done. And I'm like, that has never happened to me. And this is a fantastic product. I helped the carrier develop this specifically for you guys. I was like, I need to make sure we have something. So that one, when you actually click on more info there's a whole video that we've put together. Maybe eventually it'll show up, but you can watch this video. It's on the landing page, and then you can sign up there. Or again, guys, none of this you have to do by yourself. I'm here. Kelly's here. My team's here. We're here to support you and answer questions, but we've tried to get everything at your fingertips so that you can kind of at least take a look and go, okay, at least know where to go look. I know what the plans are, and then we can talk through it. Now, none of these pieces fit for you. Okay, then let's get on the phone and find something that does fit for you. If you're in some of those states we can't write, guess what? I do have some other plans available in the states that we can't write these plans. And they are going to be true Blue Cross or true Cigna. And those plans are going to be higher because we got to pay for that big giant name. But we do have other options for that. In California, sometimes that actually might be a better fit. A couple of you we've already put on those plans. So that being said, we have something for everybody, no matter where you live. If you can't find it here, or you just want to chit chat, then you call me, you text me, you email me, whatever it is that we can do to help. You cannot text this phone number here, as this is my office line. Okay. But you can get a hold of me. You can go all the way down here and fill out anything. If you need me to just reach out, that comes directly to me and Kelly. So if I happen to be out, there's Steve's pretty picture, y'all, just so you know that he did, he has looked at this once in a while. And then let's say you do want dental or vision, disability, anything like that, that's true medical insurance, will call me, because each one of those cases are going to be different based on where you live, what your needs are, your family situation, etc. Oh boy, guys, that was a 45-minute call. What did I not get to, Steve? I hope I answered all of it. Okay, that's kind of where I'm at. You guys, what did I not get, Steve?
No, look, I think you covered everything. The problem I have is that I just, It's complicated. I'm not an expert at this stuff. That's why you're here and that you do what you do. But for anyone that is just like on the fence, trying to figure out, hey, what is the best path for myself or me and my family in my case? Should they just contact you first? I mean, like obviously, I
Absolutely.
love that you have a landing page that shows them everything. Uh, I'm just one of those guys that doesn't
Yep.
know enough to understand even what I'm looking at. So just contact you.
Absolutely. And I understand, guys, the IRS and then me. Okay. I know where I fit in the food chain as far as I don't want to talk about it. They make this stuff so confusing. They've done it to you on purpose. Okay. They don't want anyone to understand what they have. I am happy to take a look at what you have now and tell you stay where you are. Okay. I will be the first to tell you that, or I'll be the first to say this isn't a good fit for you. I want you to know what you have. I want you to know how your plan works, whether it's with me or somebody else. And yes, Steve, I'm more than happy to talk through specific situations with any and all IFRA members. And just to give you guys an understanding, you are my bread and butter. I spend my time, I have dedicated my business to helping the furniture market because it's just where I feel like I've been called to be. So I am full time dedicated to the furniture industry. Everybody else can take care of everybody else. So if you have questions, that's what I'm here for. Now, I will tell you, if you're watching this live today on 620, I'm taking vacation next week, so I may not be available. But I will be. I'm usually always available by phone or text. Kelly is. If it's not me, Kelly backs me up, and vice versa. And then again, we have a good support team. So please reach out if you have questions. If you want to talk anything about these plans, anything like that, I am always available. My contact information is here. And again, if you just fill out something quickly at the very bottom, here's my email and my phone number. So feel free to reach out anytime. That's what I'm here for. And I really appreciate every single person being a part of this call. Thank you so much. And I guess, Steve, I will, close it up.
Yeah, I'm gonna just if there's
Okay.
anyone on this call that has any questions, please either just drop them in the chat or feel free to unmute and ask them. That's why we're here and we're live. Um, but I'm really excited about this, Tish. I can't thank you enough for putting this all together. It's nice to know that even though you're a 1099 independent contractor, you still have group plans just like a traditional W-2 employee would if you were working full time for a company. You've got major medical options. You've got preventative only. You've got the limit plan, those value plans, which maybe if you're young and only go to the doctor a couple times a year, that's not a bad thing to have.
Yeah.
I know I had a uh, almost like an Aflac plan. I plan on switching to the new was NCB and
NCBA. Yeah.
NCBA plan just to have the
Yeah.
other pieces that are part of it rather than I was doing it just for accident insurance. So
Yeah.
I'm excited to have all the other
Yeah.
perks that come with it.
Something
And
that has, I mean, say you have a high deductible plan, like with your major medical, this the insurance piece alone, right? For like one of your kids get hurt, that's going to cover your deductible.
yeah,
It's going to pay for your deductible, and then that way, if it's more than the 5,000 or 10,000, depending on which plan, you've more than covered yourselves, and you don't have any out of pocket. That's the best part.
right. One question did come up. Can you share any information about the dental or vision?
Um, it depends on where you live. So reach out to me directly, guys, on the dental and vision. I mean, the NCBA is Aetna PPO, so it's going to give you. It's discounts. It's not going to be full insurance. But if you want full insurance, every place you live is different. So make sure you reach out. Oh, and I just see Laura is on this call. So hey, Laura, how are you? Laura Snyder does all of our Medicare. So if you're 65 and over, or you're retiring, or you're leaving your job and you need to decide which way to go, reach out to me. I'll get it to Laura. Laura does come with me to market. She will be there in October. I didn't realize she was jumping on. So we do have somebody for Medicare too. So FYI, these plans are for under 65. So
Fantastic. And just again to clarify, so say someone's on the call and they move to a new company like next month, and they can jump in on these plans by the 20th of each month.
yes, sir. Then 20th each month, you can stay on, like I said, you can stay on a month, you can stay on forever, you can stay on however long you want to. So yes, sir. Yes. then there's a lot. If we, let's say for instance, you lose your job today and it's too late and you're going to need coverage July 1. If you're in a short-term medical state, because a lot of states don't have them, but if you have short-term medical, we can put you on something temporarily until to get you through that window. Okay. So again, when you're in those situations, just call us, reach out, however, and we'll see how to best step you through that.
Okay. Okay, great. Any other questions from the folks that have joined us today?
So what I think we can do, hi, Maddie, Vision and Dental, just call me, okay? If there's a way that we can add this video to the front end, we can put it on top. So then that way they'll have that as well.
Yeah. So I'll make sure this video is available. I'll send out the links that we shared in the chat today, both to the landing page or your landing page and the Legato landing page. Of course, I know from experience, the best way to make sense of all this is to contact Tish, because she really does explain it in a way that even I can understand. So,
Thanks, Steve. I appreciate it.
No, I appreciate you. Thank you again, Tish. Thank you, Noelle, if you're still on, and thank you everyone for making some time today. I really do think I'm not biased, but we really do have the best, most complete offering in the industry as far as being a 1099 independent contractor. And it sounds like it's only going to get better here real soon.
Yeah, so we're doing good, man. We're doing good. Yay.
I'm excited about that, and obviously more to come. So as soon as we get more details on some of the home, auto, all the other pieces, you guys will be the first to know about that, and we'll be distributing that information out soon.
Okay. Thanks, guys. I hope you all have a great week, a great summer. Reach out to me if you need anything. Thanks again, Steve. I hope you all have a great weekend.
Thanks so much. Yeah, that's right. Thank you. Everyone take care.
Bye-bye.